Right. Talking about policy is never, the slot you would put your hands up for and want to truly do, because most people look at policy and think, and we get masses of policy documents all the time, and we are constantly having to sift through it all to try and make some sense, and then be able to apply it in the clinical setting. So what I've tried to do is to pull out the policy documents in Scotland that relate to mental health, the NHS, looking at the mental health policies. And when we talk about employment within the NHS, it's predominantly the allied health professions that they relate to, and within mental health, it's predominantly occupational therapists within the NHS in mental health services who are at the front of employment services. I've also tried to pull out some documents that relate to employment in relation to our third sector partners, because again, a lot of the employment services and projects within mental health are delivered in partnership and through lots of co-production and joint effort and collaboration. So I want to make sure that I try and capture some of that. And then in relation to the CRT, I've tried to look at the psychological therapies, strategies and policies that have come out around that. Not much, but my task in the next 10 or so minutes is to try and give you a whistle-stop tour history of that to say where we are at. So, diving in. I don't have a presentation. I have show and tell. And what I've done is I've marked the pages of the policy documents so that if anybody wants to go and have a look at what the policy actually says, you can go and have a look. Okay, I'm going to put them on the table over there. Don't feel that you have to if you don't want to, but it's there if you do. Okay, so a wee bit of statistics first, to set the scene. So we have currently about 18% of the working age population who have a mental health issue. So that was a study by McManus that pulled those things together. So just generally, in the everyday population, there is 18% of people already dealing with a mental health in the workplace. In relation to job seeker claimants who have mental health issues, there's 23% of them. So you've got 18% of the general population in work with mental health. Now you've got 23% of people claiming, job seekers allowance, 23. And then we have people who are claiming sickness benefits, who are putting their primary condition down as mental health. There's 40% of them. And then, when we start to drill down to the individuals that have a severe and enduring mental health problem, we find that they're not actually in these statistics, because 79% of them aren't even in work. Okay, so sometimes, the figures can be a wee bit confusing, but it's the figures that are often driving the policy, because the Scottish Government, they're saying, these are terrible things, we need to do something about them. Okay, so just setting the scene there. Okay. The policies. I thought as well, I'm going to get to the policies in a minute, honest. Within Fife, I was looking at the historical stuff that I have in my cupboard. I'm sure everybody has a cupboard like that. And I came across an old document that we produced in 1996, a collaborative project with Fife Employment Access Trust. There was SAMH, there was NHS Fife, where we were looking at employability for mental health and trying to work in collaboration with each other back in 96. And yet when you start to look at the policies in relation to mental health and employment and psychological therapies, you didn't really start to see stuff until 2004. So a lot of what was happening on the coalface, we were dealing with, as probably a lot of you in the audience were, dealing with supporting individuals with mental health issues into work way before it became a political issue. So I kind of like to think that at the coalface we have, a strength if we collectively work together to push and drive policy rather than being snowed under by it all the time. Right, so 2004 kicks off. We've got Healthy Working Lives, the Plan of Action. Okay, and then still in 24 we had Working Differently. It's a nice wee document by the AHP Federation at the time, and AHP is Allied Health Professions, if you're not familiar with that term, and it includes OTs, physios, those of us. And in there they're mentioning about mental health, about employability, and the role that the AHPs have in health to be supporting that, clearly stating that it's a health issue, because often you get the fight between, oh, well, it's not health, oh, it's somebody else's, we do something different in health. Okay. And then we had the Workforce Plus and Employability Framework for Scotland, so they were catching up. And then in 2006, as we move through time, Delivering for Mental Health. And then 2007, the Coordinated, Integrated and Fit for Purpose, a Delivery Framework for Adult Rehabilitation in Scotland. That was, it was a nice purple document, and for the life of me, I couldn't find it. And it was just, had lots of aspirations to it, but, within health, not that much really happened with it, but it aspired to a lot. But again, it was stressing the importance of AHPs in health and delivering VR. But it was then starting to push in this document about partnership working and collaboration. So the policy was catching up with what was happening in the coalface and finally getting to the point that health can't do it on its own if it is choosing to do it, but we actually have to do it together, working in collaboration. Sorry. And then we get to Work Matters. It's a nice wee nifty book from the College of Occupational Therapists, because they'd finally were catching on that as OTs, in health and elsewhere, as well as assisting our patients to be work ready and aware of our own strengths and well-being and stuff like that. Actually, as clinicians, we needed to be safeguarding our own well-being and career progression as well. So this document was almost a combination of the kind of two things there. Okay. And then we got on to Recovering Ordinary Lives. Nice wee nifty document as well. And again, this was from the College of Occupational Therapists, and it was stressing that in a 10-year strategy, which we're still in, because this was from 2007 to 2017, so there's still a year of this strategy professionally to go. It was talking about how that as OTs we should be supporting adults in attaining, maintaining and regaining work roles that will increase the number of occupational therapists in this field. And what we're starting to see, certainly with FEET, is that the spread of skill is moving from the NHS into the third sector, where other professionals are being employed directly. So rather than it being health and being, FEET or SAMH or Capability Scotland or whoever, actually now it's, the skills are being placed where they're needed in whatever organisation. And we can see how the policy drivers that were pinpointing and pointing towards that kind of development are actually starting to happen at the coalface. Okay. And then we got on to 2008, where we had the first, document with regards to the psychological therapies. I'm not saying the first, but in relation to that we could tie into mental health and across the different disciplines. And that was the Mental Health in Scotland, a guide to delivering evidence-based psychological therapies, and it's referred to in short term as the Matrix. There was quite a lot of difficulty with regards to the Matrix. One, the cognitive remediation therapy wasn't considered to be robust enough, and the evidence base wasn't considered to be strong enough by NES, that's the NHS Education for Scotland, who produced this document and who are rolling out across all the NHS. So CRT, despite the fact that at this point it was being used in Fife across and embedded into our employability services, the main psychological therapy that we were using wasn't on the bona fide list of therapies. So when resources are being put into the NHS, they're being put into to develop staff's awareness and skill around CBT, behavioural activation, mentalisation. These are all good psychological therapies. I'm not dissing any of them. And certainly my staff have been party to developing those skills. But the CRT, which is a significant therapy that we use on a daily basis with our various projects, wasn't included in that matrix document in 2008. So since then, there's been quite a bit of push, and they had a subsequent review of that document just 18 months ago now. And even then, it still was not included. So, you know, as Claire was saying, there is a need for us to be trying to build the evidence locally so that we can be encouraging CRT to be included in these types of policy documents. Because if they're in the policy document and resources are coming down to implement it, then we have access to the monies to get people trained, to raise awareness, to implement it, to make it part of, employability services. So strategy can sometimes include, but it can also exclude, services. And that's been an ongoing issue with regards to the psychological therapies matrix. Anyway. And then we had towards a mentally flourishing Scotland, which was a very good document. And priority 4 in this was to do with mental health, employment and working life. So the Scottish Government was starting to really get to grips with the fact that employment was a health issue, and we needed to be focusing on it and starting to make it a priority, rather than it just being, a paragraph or, a page in a much wider, broader document that's gone before. And then we had the kind of health works, and the key element of that was to start to build the capability of the wider NHS staff. So the focus was becoming on it being everybody's business in the NHS to start asking the question about people's work. So it wasn't just about predominantly the AHPs anymore, it was about everybody else. Are we asking, when people come into the NHS, are we asking them about their work status? And then when we do ask them, more importantly from my perspective, what do we do about the answer? So in 2009 there was that shift again. So it wasn't just about saying work's important, it was about saying, well, it's important and we now need to do something about it. And that's been the thrust within the NHS of late. And then in 2010 we have a working life for all disabled people, the supported employment framework for Scotland, which again was still having mental health, but it was included in the broader. So again we're kind of widening out in the policy so that it's not just mental health specific anymore, it's starting to be actually employment is across the spectrum. And there's disadvantages to that for us because when we look at the stats as we did at the beginning, if 79% of the people with enduring mental health problems are not in employment, then to put our policy focus on those who are in employment, then immediately that whole, category of individual is completely excluded. Okay. And then we start to have, again, a narrowing down again from the Scottish Government, looking at who's delivering the employability work at the coalface. And we start to see in the realising potential, the allied health professions in mental health. And one of the four main work areas in this document was in relation to employment and vocational rehab. And that was about, again, just consolidating and raising the profile of, in health, there are people doing this. Because what I found in my partnership working is that often in the third sector, you guys are, you've got your own drivers, your own stakeholders, you've got funders that you're answerable to. There's a whole plethora of other pressures on our third sector partners that in health we don't experience, or we experience in a different way. And the knowledge and understanding of what's happening in health, because most people, when I first speak to them, don't really know what an occupational therapist is, don't really know that part of our main remit is to assist people with their employability and vocational rehab issues. And the policies are NHS policies, so it tends to just be the NHS who are looking at them. Anyway, and then we start to look at, again, even more specific issues in health with regards to the forensic population. So even within mental health, you will have smaller and smaller groups of people who are even increasingly. So when you look at the stats for the forensic people, it's not 79% of them that are in unemployment. You're in the 80s and 90s, depending on what information you look at. So even within that group, these guys are even increasingly disadvantaged. So there was the focus to be looking at what we need to do in order to support them. And then we move into the 2000s and 11s, and there was some 8 or so documents that were all talking about mental health, that all had stuff to do with employability, that were all focusing on different things and had different priorities, and you were in this blizzard of policy in 2011 and not really being all that sure exactly what to do. So again, it was a bit of a minefield to look at that, but the same thread is coming through the policies, that partnership is key, that working in collaboration together is key, that we could be influencing policy from the coalface as well as being the recipients of something. So it's not always a case of stuff being forced on us. We have, the ability to evidence policy up the way and not just be passive about receiving it on us. Okay. So we move on to 2013, where, as Claire mentioned, there was the sign, Managing Schizophrenia sign booklet. And in that, it's starting to actually state that CRT, as a therapy of choice, had a B rating, for the clinical evidence. And Gordon at the front here on the table, wiggling his toes. He had quite a lot to do with ensuring that the guideline included CRT, and had to work quite hard in that group on behalf of the wider community to make sure it was there. And then it being included within the booklet that is given out to kind of family and service users and stuff like that to guide and inform them. So we are starting to see, CRT being mentioned, we're starting to see mental health and specifically the enduring mental health population of people being mentioned. And we are being constantly encouraged now to work in collaboration. It's quite clear in the policies now that no one service can deliver a robust service for people with mental health issues and employability needs. We have to do it together.